Okay, so guys, understanding pulmonary hypertension and pulmonary edema. What's the difference between these two? We have touched on this when we discussed right heart failure, but just to reiterate, in order to sort of give you guys a holistic understanding, with pulmonary hypertension, it means that the pressure in the pulmonary arteries are increased. Okay, is everybody clear with that? So, previously, when we discussed left heart failure, we did mention that the pressure in the pulmonary veins are increased. So, keep that in mind, hold that in thought. So, with the pulmonary hypertension, we said that the pressure in the pulmonary arteries is increased, but why? Because there is something that is compromising the integrity of the vessel wall. There is fibrosis or there's inflammation. There's something happening that is causing that narrowing of the blood vessel, resulting in pulmonary hypertension, such as what? COPD that would result in fibrosis, inflammatory conditions, connective tissue diseases, right? So, all of these things are causes of pulmonary hypertension. So, how does pulmonary hypertension link up to right heart failure? If you think about it, the definition means what? That the pressure in the pulmonary arteries is increased. And if you are remembering the cardiac cycle, which you should know very well, the right the right ventricle is pumping to what? The pulmonary trunk. Okay, so this means that should there be pulmonary hypertension, the pressure that the right ventricle has to overcome is now much greater, which means that the right ventricle has to work a lot harder in order to overcome the pressure in the lung, which is obviously going to result in right ventricular hypertrophy and, as a complication much later, right ventricular failure. Okay, and remember that this is called cor pulmonale. So a patient has COPD, develops pulmonary hypertension, and the right ventricle is pumping harder to overcome that pressure. When we say overcome that pressure, we mean in order for blood to basically flow from point A to point B, right? The pressure in point A must be greater than at point B. So if the pressure at point B is greater, it means that point A now has to overcome resistance. Greater force is required. That is why you're getting hypertrophy. That is why the right ventricle may fail, because you have this pathology that's happening in the lung. That's called pulmonale. Now, the question here is, how does this link up to the left ventricle? Because this whole thing is a system. So we said, keep that in mind. The left ventricle, in left ventricular failure, you're having what? You're having, because the left ventricle is not functioning well, the blood has to be somewhere. So it's being backlogged in the left ventricle, in the left atrium, and then in the pulmonary veins. Because remember, it's the pulmonary veins that are emptying into the left atrium. So, because blood is being backed up in the pulmonary veins, that is why we are having that increased pressure in the lung. So, you're having what? Increased pressure in the venous side of the system. But we said pulmonary hypertension was increased pressure in the pulmonary arteries. But as a complication of left ventricular failure, you can get pulmonary hypertension because the pressure may be so high in the venous side of the system that this is now backing up into the arterial side. In very loose words, that's the idea. Okay. Now, pulmonary edema is as a result of pulmonary hypertension. Not always, but in this case, because we just said that there are many, many causes of edema. But in this case, the pulmonary hypertension, the increased pressure, is increasing the permeability of the blood vessel and causing fluid to leak out, thus producing pulmonary edema, which means that we have fluid that is leaked out of the blood vessel and into the interstitial and the alveolar space. Okay, so I hope that helps to